Bwrdd Croeso. Welcome to everyone to our first board meeting of 2022. Extend a warm welcome to all the board members and the people who will be joining us through the board meeting to present this morning. And also to welcome people who are listening in to the board meeting and watching. As we are still working under Welsh Government guidance around working from home wherever possible, we're obviously still using the Zoom platform to conduct the meeting this morning. And I'll say a few things about that in a moment. If people wish to, they can catch up with this recording of this board meeting via a link on our website to our YouTube channel. Simultaneous translation is in place for board members, people attending the board, and we hope that through the Zoom platform, we've been able to ensure that people listening in will also be able to hear a translation of any contribution in Welsh, should they wish. And now I'm going to step into very dangerous territory. I'm going to tell you how to do that. And I do hope it works for those people who are watching in. At the bottom of your Zoom screen, you should see an icon. I think it's usually to the right of the icons in the middle of the screen at the bottom, and it's an icon of a world icon. If you click on that and then select translation, that should then give you the English feed if you're watching in to the board meeting today. For those of you who are staff members watching in, if that doesn't work or if there are any issues, if you could drop an email to the governance team, it would be very helpful. And equally, from people outside the organisation, perhaps the best way to provide us any feedback would be via our Twitter account. Do let us know if it doesn't work. We're very much at the whim of what Zoom can deliver, and we are keen to push the boundaries around translation as much as we can. So I do hope it works for those people who are joining us, those members of the public who are joining us today. As ever, with working with this sort of technology, we might not always be looking at the camera and looking at our papers or other screens with our papers on the screen. So please accept our apologies for that. It is the way of things as we are at the moment. We're aiming to finish by 20 to 2, and we've got a couple of comfort breaks scheduled in during the meeting. So if people are happy, I'll start to move into the main body of the meeting and to the consent section. There are any items should have in the papers in the consent section should have been brought to the attention of the relevant office, and hopefully any questions people have will have been answered. Apologies for absence. No, I've had no apologies from absence, and looking around the table, I don't think there are any. So if those could, we obviously note there are no apologies. And equally with declarations of interest, I've had no declarations of interest given to me. Has anyone got any that they've noticed subsequently to getting the papers? No. Thank you very much. So as I say, are there any issues in the consent agenda? I know there's a couple of items of accuracy in the minutes we'll come to in a second that people wish to be moved up into the main body of the agenda. No, thank you very much. So if we go through the minutes, the first minutes to approve for accuracy are the minutes of the board meeting, public board meeting held on the 25th of November. And I think you've got a couple of little points you wanted to draw to our attention, Rydian. And you're on mute.
Thank you, Chair. Page 14 of 22 regarding GP systems. I just wanted to highlight that the inaccuracy there is that we already have the GP service working live and referrals are coming in. So it's GPs, it's who send, and GPs already have a choice regarding e-vetting, advice, redirect, and accept. And that the change that we've made is to move the markers on the template so that it becomes clearer to those who are vetting that the request is for advice. It's a very minor change, and it was the system has been presented at the Planned Care Summit. So plan needs to be spelled correctly, please, and it was received. So that's paragraph 2 and 3 of page 14 of 22. I can provide the Secretariat with the minor details if you need.
Anything else, Rydian?
No.
Okay, people happy to accept that amendment. And Carwyn, you've got one as well, I think, a minor amendment you want to draw to our attention.
Yeah, just a very minor point. On page 13 at the bottom, it talks about the incident that we had with the Health and Social Care Network. It says that the data was sent via Swansea, as in the data was sent elsewhere instead of being sent to Swansea, which is what caused the problem. So it's just
if we could make that amendment as well, people are comfortable with that. And subject to those minor amendments, people happy to approve the minutes as a true record. And then moving on to the minutes of the private board held on the 25th of November. Again, are people happy to approve that as true record? Thank you. And just quickly, are there any further matters arising out of those minutes that haven't been covered by the agenda or you've addressed elsewhere? No, thank you. If we could note the action log and the fact that all previous actions are now updated and marked as complete. Thank you. And then approve the board annual cycle of business, 22-23. Thank you. And note the contents of the forward work plan, including items scheduled to come to future board meetings. Thank you. And we're also noting the end of year reporting arrangements for 21-22. That may be something that Claire might touch on a bit later in her report in terms of the way we have to close our accounts. Thank you all very much. And if I can move now straight to the main agenda in section 3, which is always a nice part of our board meetings, is listening to a presentation on enabling us to listen and learn. And this morning, we're joined by Sally Lewis, who's going to talk to us about value-based healthcare. But before Sally kicks off, perhaps I could ask Rydian to introduce this section on the agenda, please, Rydian.
Thank you, Chair. Look, I'm absolutely delighted to introduce Dr. Sally Lewis, a fellow graduate of the University of Wales College of Medicine. And when I look on the Zoom screen, I realise that given that we were in the same year, I've had a very hard paper round. So it's a pleasure to see you, Sally. On the important things here, there's an attached presentation regarding the Welsh Value in Health Centre document, and I would encourage listeners to read that. I'm reminded of the medical student question by the consultant orthopaedic surgeon, who said, how many types of hip replacement are there? And the clever medical student said, 2, one for the left hip and one for the right hip, which of course is the wrong answer. The first question is, why do they need a hip replacement? Should they have a hip replacement? And which prosthesis is going to give that individual the best outcome to get back to an active life? And I'm sure that we'll find this presentation informative, and I'd like to ask Sally to start. Thank you, Sally.
Thank you, Rydian, and it's a real pleasure to be here. Thank you for inviting me. As my slides come up, I'm just going to explain what I'm going to talk about this morning. So I'm going to give a brief introduction on what we mean by value in health and why that's important now, and in particular as we move out of the pandemic. And then the tools that we need to deliver value for the patients and population of Wales, and the critical role that DHCW plays in that, and the really strong partnership that we've now forged between DHCW and the new Value in Health Centre in Wales. Next slide, please. So first, I'd like to define what value is and what it isn't. So many people may cynically, I guess, jump to the view that this is all about cost cutting in healthcare, and that couldn't be further from the truth. It's really this definition, which is to pursue the equitable, sustainable and transparent use of our available resources to achieve better outcomes and experiences for every person in Wales. And when we pick that apart, we realise that we need really good information to help us do that and to share with everybody how we're using our resources, because there will always be choices that we need to make given the finite nature of those resources. So it's really, really important that we ensure that we're getting the best outcomes for people. Rydian's just given us a good example from orthopaedics, but we'll dig into some others in a moment. And that we do that equitably, so that we think about those from more disadvantaged groups. It's not just about the people who shout loudest who are getting those resources, but we're really guided by the sustainability of our healthcare system and making sure that we can take the NHS through the 21st century and improve the outcomes, the health outcomes for the people of Wales. Next slide, please. So in doing that, there are some quite complex issues to pick apart, and I've put a link to a report at the bottom of this slide, which will enable you to dig into some more detail if you're interested. But we're always trying to deal with the tension between the needs and wants of individuals and the needs and wants of a population when we're looking at that equity question. So I'm a GP by background. A lot of my work throughout my career has been in figuring out with patients, what are your goals and what are your preferences around your healthcare? What outcomes are you seeking to achieve? And then jointly working out how we're going to achieve those goals together. So once we've figured out what matters to people, we need to provide them with the best data, the best information, so that they can make the best choices about their healthcare in their own context. And at a population level, we need to understand how we distribute resources to improve outcomes and marry that up somehow with those individual wants and needs. And value-based healthcare really sits at the intersection of that, where we're trying to achieve the best outcomes with the available resources for individual conditions like heart failure, cancers, or dementia. But trying to balance that and trying to do that in the best possible way through improving the quality of our services, reducing unwarranted variation in care. So that's care where there's low value. So for example, an outpatient appointment that a patient doesn't want or need, or a surgery that a patient doesn't need in the example that Rydian just gave. Quality improvement of our services. So taking feedback from patients about what their outcomes and experience of healthcare are so that we can improve the quality and experience across the system. And new models of care. So through the pandemic, we've seen an acceleration in digital technology supporting new models of care, for example. How do we use that in a way that creates the best experience and outcomes for everybody and doesn't exclude those that are disadvantaged or who can't use digital technology in that way? So there's lots of issues in there, and I commend the report at the bottom of the slide if you want to know more about that. Next slide, please. So how do we improve better outcomes for patients in a sustainable way? Well, there are things that we need to do to support patients. We need to raise health literacy across the population and invest in supporting healthy behaviours, but not just around preventing disease, but how do we get people to be able to live their best lives, even if they are living with a condition or multiple conditions. And so self-management is not something that happens by accident. It needs to be supported actively by the healthcare system. And part of that involves providing really good information and data, both to healthcare professionals, but also back to patients. So hopefully I'm starting to build a picture of why data and information is so important and hence the relationship with DHCW. And then on the healthcare side, of course, we need to understand how we're using our resources and also how we're performing as a system. So we need to decrease that unwarranted variation across pathways of care so that we're truly practicing evidence-based medicine. And that requires regular look at data and information to make sure that we're doing that. New models of care I've mentioned, perhaps supported by digital technology. And really thinking about how we tailor treatment to the individual's needs, including their preferred place of care, whether that might be at home or in hospital. And of course, one of the really important things about value in health is how we collaborate across the system, patients and clinicians collaborating with financial and operational managers, and also with informaticians. And in this way, we can really start to drive an optimum healthcare system in Wales to improve outcomes in what is, as you'll appreciate now, a really difficult time as we emerge from the pandemic. Next slide, please. So no one organisation can deliver a value in healthcare alone. We can't do it in general practice on our own, and secondary care can't do it on their own either. We need to really look at it from the perspective of the population and patients accessing healthcare, really thinking about value in terms of the sum of all interventions across somebody's journey of healthcare. So yes, we need to invest in prevention and early diagnosis because often that results in a better outcome. But we also then need to focus on optimizing interventions, whether that's optimizing medicines or getting the best outcome that we can from surgery. And also not neglecting supportive treatment and rehabilitation, and also end-of-life care, so that people have the best experience of healthcare as they near the end of their life. Next slide, please. So in order to do all of this, and if you read the strategy which has been included in the papers, there are 6 key areas of work that we undertake in the Welsh Value and Health Centre supporting the healthcare system. And I want to really focus now on the work in partnership with Digital Health and with Digital Health and Care Wales. So as I mentioned earlier, if we're to understand our healthcare system and understand the needs and outcomes of patients, we need to be collecting that information from patients and thinking about how we share that outcome data between organisations so that we can improve by learning from each other and really raise the bar and the standard of healthcare and improving outcomes across Wales for all patients equitably. And that really taps into the work on the national data resource within Digital Health and Care Wales. And as that grows in maturity, it makes it a lot easier for us to understand our healthcare system and then take action accordingly. And the other really important piece of work is how we improve communication with patients and how we improve digital communication with patients. So we know that when we communicate digitally with people, we can hang a lot of tasks off that. So for example, as a patient, wouldn't it be great if we can flexibly access our clinical teams when we've got a problem, if we can book, cancel and rebook our appointments in the way that we would do with a hairdresser, for example? Can we give information to our clinical teams about how we feel on a given day through a patient-reported outcome questionnaire? Can we see our blood tests? Can we have tools to manage our conditions? So this is a really important work in terms of supporting people with the information they need to get the best outcomes, but also how they interact with the healthcare system so that we can improve those new models of care and really improve sustainability of the healthcare system, which has an impact then on waiting times and so on. Next slide, please. So to conclude, I wanted to, excuse me, focus on all of the areas where Value in Health works with DHCW. And as I was writing the list, I thought, oh my goodness, it's even more huge than I had thought. So there's an awful lot of behind the scenes work going on with data. So essential data work, making sure that we have common data standards across Wales, and that the data is of good quality, and that we have clinical teams looking at that data to validate it, so that we can start to visualise that information in the Welsh Clinical Portal, so that clinicians have really good information at their fingertips to support decision making, and the creation of all Wales data tools for clinical and operational teams to use to see how they can improve care and to see where the gaps are in service and what resources are needed to improve outcomes. So that relates to the generation of our standard reporting products, looking at outcomes and looking at processes of healthcare to do that improvement. And the Value in Health Centre has a dedicated team within DHCW that does that for us in partnership with the clinical reference groups across health boards. However, there are many other individuals within DHCW who also are supporting this work, and I'm very grateful to them. Information governance, so how we manage that information is really, really important so that it's trusted. How we're using that information, that's something we work very closely with DHCW. And the digital services for patients and the public programme, that's that digital communication that I was talking about, and there's a little diagram of how that works on the right-hand side there. How we create that environment for trusted and safe and secure communication with patients so that information that they give us is secure and people can feel confident about how we're using that data to support their care. And you'll see at the top right a little screenshot of our new national HIP dashboard. So Rydian mentioned hip surgery at the beginning. This dashboard helps us understand what outcomes people are getting from their hip replacements and how we can improve that. I'm also grateful to DHCW for helping us create our Value in Health website, and I'd commend you to have a look at that. And also how we develop in the advanced analytics space. So as the national data resource matures, how do we use information to predict demand, for example, so that we can really seek to meet that demand in a timely fashion and improve outcomes for the people of Wales. And up until recently, I've been the chair of the advanced analytics group that sits underneath the National Data Resource Programme, and that really has been an inspirational piece of work to be involved with. So you can see that Digital Health and Care Wales is absolutely critical to the delivery of value in health for Wales. And I hope I've made the case that value is a really important concept as we seek to improve outcomes for the population of Wales in the coming years. Thank you very much.
Thank you, Sally. I don't know if you wanted to come back yet at the moment, Rydian. I know Helen wants to come in, but shall I let Helen kick off, Rydian? You have, yeah.
Yeah, fine. I'll come in when invited.
Well, just put your hand up if you want to, Rydian. So, okay, Helen.
Thanks, Chair, and thanks, Sally and Rydian. But I think that was a really kind of, I know it's quite hard to get across in 10 minutes, isn't it? All of the amazing work that's going on with this programme. And I know we've got, you've been on a long journey with this, but it does feel like now with the Value in Health Centre that actually this is, and actually the pivotal role that it's got within kind of the strategic kind of landscape now within Wales, that this really has got the momentum that it's needed to actually drive this forward. I guess my question was about really sharing with us what you think the biggest challenges are going to be from a service perspective to truly shift into a value-based healthcare culture, really. And I guess your views on where we could be helping more with that, if you know, if there are any areas where you think there are still some gaps really that we need to be supporting.
Yes, thank you, Helen, and you're right. It has been a long journey, but it does feel like we're on a very firm footing now with the establishment of the Welsh Value in Health Centre. The reason this is really important from my perspective is that the system still operates largely in the way that it did 70 odd years ago when the NHS was created. It's really hard to shift such a huge oil tanker as the NHS and sort of reimagine how we might deliver that care whilst we're still delivering care for patients. So having really good information as to where we can have the biggest impact with changing that system of care incrementally is really, really important. So focusing what the really big ticket items are to support large numbers of people, which then releases capacity in the system for us to do more for people, essentially. So if we look at the work on diabetes, for example, how we might understand using the data, how better to support people who are finding it difficult to access services so we can improve their outcomes. and how we perhaps even think about strategies to reverse type 2 diabetes, we can really then start to get into how we improve those outcomes. So I can't emphasize enough the importance of those two elements, the creation of the standard reporting products, the data dashboards to inform that decision making, and that relates to the maturity of the national data resource, of course. Really, really important. And then the other one around how we enhance that digital experience for patients who want to interact with healthcare in that way, and really maximize that, both in terms of understanding the information that patients give us and feedback about their health and care, but also how that enables that flexible delivery of healthcare in those new models. So it's really complex situation, but those are the two things that I would focus on as being the most important.
Thank you, Sally.
Rydian. No, sorry, not Rydian, Andrew.
I just wanted to congratulate Sally and the team for the work they've done in Value in Health. So in my professional capacity as a Principal Information Governance Lead, I've been very, very fortunate to have been given the opportunity to provide some support to the team. And I think it's just an excellent model by which to use data to improve the way that we deliver care. So I just wanted to say that really, and just recognise the work being done by the programme and say a big well done.
I'll let you bask in that reflected glory, Sally. Thanks, Andrew. If people, Rowan, and then Marion.
Hello, Sally. Thank you for that. That was great. And on the theme of hips, I had a hip replacement fairly young, sort of 42 for various reasons. And I remember going and analysing longitudinal outcomes from Australia and Canada, large published studies, to understand by gender, by prosthesis, by surgical technique, what was likely to give me the best outcome. And I had some fabulous conversations with surgeons who I think were slightly surprised a prospective patient would walk in through the door and wanted to have that kind of discussion. But I think it's important to say this model adds value both ways, both to the service, but also to patients. They can feel more confident about their healthcare, and that engagement's really important. So Sally, we're all real fans and we want to see this succeed. I guess my question though is really around that person-centered. What does that mean now, and what might it mean in the future? Because I think for us in Digital Health and Care Wales, it's so important that we make sure the right data is in the NDR to allow us to do those analyses at a resolution that can really inform the best outcomes for the cohorts that we have in various diagnoses. So what are your thoughts there, and how can we be thinking about that for the medium and long term as well as the near term?
Thank you, Rowan. Good to see you. There are many factors that support person-centered care, as you know, having enough time in the consultation, professional attitudes, all sorts of things. From a data perspective, let's stick with hips because we've been talking about hips as a theme today. As a 50-year-old woman, I would like to go into a consultation and be able to ask my consultant, what is the likely outcome for somebody like me? Not somebody in a trial, so you had no choice but to use trial data from another country. But can we take that to, what about somebody my age, my sex, in Wales, with my other kind of health history? What outcome am I likely to get if I have the surgery now, if I have the surgery in 5 years' time, if I have this prosthesis or that prosthesis, as Rydian alluded to, or what's the outcome if I don't have it, these are the types of questions that people need to be able to ask and have answered. So we're a little way away from that, but not too far away, because to be able to do that, we need to be able to link data on devices that people have, so on the prostheses that people have, and to be able to link that to their clinical outcome and the patient-reported outcomes. So was the patient satisfied with that? You know, have they had their pain relief? Are they mobile? Are they able to do the activities they thought that they would be able to do? So that means we have to sort out all sorts of data flows, as you know, from different data sources. And we have to build trust with patients around the information governance, because that means we need to link data to do that, which is why Andrew's involvement and the team is so critical. I'm so grateful, Andrew, for all your involvement. But that's where we need to get to. And it's of absolutely critical importance, because HIP is a simple example, but there are many other much thornier examples of where there are trade-offs in the decision-making that we make in healthcare. So I would use the example of chemotherapy in a palliative cancer situation. You know, people really need to and want to know, you know, what are the trade-offs between my quality of life and my length of life, and I need to know that so I make the best decisions about my treatment. So that's where we want to get to.
Marion, and then Grace, and then yourself, Rydian.
Thank you, Chair, and I'm going to speak in Welsh if I may. Sally, diolch yn fawr am y cyflwyniad yna'r bore yma. Mae wedi bod wir yn galonogol gweld sut mae data, sut mae'n systemau digidol ni yn cyfrannu at y gwaith o draws newid